Hello, good morning. My name is Christy D, and today I will be sharing with you a tip that could definitely prevent a fracture on an existing denture. Please don't forget to subscribe, stay tuned, and ring the bell for your new notifications. Thank you. Hello, good morning. As I promised, I am sharing a video to explain a little bit more about a reline and why it's necessary and how to prevent a fracture on an existing denture. If you look on the screen here, I pulled up an image to show you what it looks like inside the patient's mouth. So this is the patient's mouth right here, and this right here is the denture. But if you notice, there's a small little gap in between there. And that gap really, what it is, it's an indication that there is some acrylic needed to be added to that existing denture to prevent it from fracturing. Now, let me explain to you what I mean by that. So if the patient wears their denture with having a small gap between the soft tissue and the acrylic, eventually when they chew, they force the denture to be bending in this awkward way that it's not supposed to, and eventually that denture will snap. So this is why it is very important to always let their patients know if they do have a lack of retention eventually, they will have to let you ladies know. Now, if they decide to just let it go like that, eventually what's going to happen, it's going to break. So then they're going to have to wait 1 day or 2 days, depending on the lab you use, to have it repaired, plus the pickup and delivery. So we're looking at 4 working days. So we get the pickup, the 2 working days or 1 day depending, and the delivery date. So the patient will have to wait 4 working days for their denture to be completed as far as a repair. In that case, then we will need you ladies to inform your patient that there will be another impression that they need to take before they can actually take the denture home. And that would be taking a wash impression, sending it back to the lab, so picking it up again, 2 working days plus the delivery date, so another 4 working days. The patient will have to be without their denture. So to prevent all of those days without a denture, especially if these patients have events going on the weekend before that week, or if they have something going on that's important for them that afternoon, it is good to always educate your patients, informing them the procedure to fix this and to prevent this from happening within the next 2 to 3 years, depending how the denture is treated as well. So the best solution, as I said, would be taking a wash impression. And the wash impression, sometimes I'm asked, what type of wash impression? Would it be the light body or the heavy body? And what I do is just say, you know what, go ahead and use the one that you believe that will be needed. So depending on the patient's gap between the acrylic and the soft tissue, is the type of wash impression that will be needed for us to be relining this denture. Now, I do want to point out, please always make sure to add enough wash impression material on those dentures for future relines. And the reason why I mention this is because there's been occasions that the patient goes through this procedure, and yet unfortunately the wash impression material is not enough to where we have to send the reline back for a new wash impression. And that's just a lot of, doorbell ringing for your patient, to where they're going to get frustrated and they're going to not feel that this experience was too pleasant. So we want to make sure that your patients are taken care of, but at the same time that you're informed of what needs to be done on your end in order for us to be able to do our part. So as long as you put enough material on the denture and you have the patient bite into this wash impression, this is kind of what it's going to look like once that impression is taken. We have enough material on this image that overlaps on this denture that guides us perfectly well. Now, if there's enough material that expands all the way to the back part of the palate, we can always adjust the palate if your patient has a tendency or is sensitive to gagging on that. So we can always adjust the palate, but as the more arch we have on this area impression, there is more suction, and at the same time as we have a perfect impression of the palate, we'll be able to get up there right. So this is why it's important to have enough material added to your dentures so that we can go ahead and have this procedure take place. Now, there is two types of relines. There is a soft reline and a hard reline. Honestly, the difference between those denture relines is just comfort. So this is what a soft reline pouring impression would be more like. Honestly, the hard acrylic denture reline is most common than the soft reline. Honestly, not sure why, but I will definitely find this information out for you and definitely make a small video to inform you what the difference is between the relines and why is the hard acrylic reline most common than the soft reline. So once that's done, the soft reline is completed. The finish on that looks more like this. This is more like a soft texture on the area where the reline impression was taken. But you can see that it looks a little bit different, and this material is much more softer to where the patient will feel support on the soft ridges. That's what the finish looks like on it. The finish on a hard reline looks more like this, but obviously this is not a finished and polished denture. You can see on this image the add-on of the new acrylic to where it will help the patient have more retention of that denture. Now, we know that we can do relines on dentures, but another question is, can we add acrylic or do a reline to an existing acrylic partial? And the answer is absolutely yes. Now, there is a different procedure that would take in place. If you notice, for the dentures, all we needed was the wash impression and we're good to go. But when it comes to the partial, it is a different type of impression that we need. For the partials, there is 2 impressions in one that need to be taken in order for this to work out. So this is what I mean about that. The patient comes in the office with the lack of retention, let's say for example on the right side. So what you will need to do is you pour the wash impression on that area. Let's say we're doing that. And have the patient place the partial back in mouth and bite it down. Leave it there. In the meantime, you'll have the other assistant, and this is the tray for the upper, but we're going to use it as an example. And you have your assistant prepare a tray for an impression. So now that you got that partial in there, you're going to have this added in there. And the patient will then have this impression taken. Then that's when you press the tray down. And when it's time to remove and the impression material settles, then you can pull out. And that is how you get this impression. That is the type of impression we need for us to be able to reline a partial. So it's 2 impressions in one. Now, there has been occasions that this procedure does take place in the office. The only mistake that is done in the office, and this is many, many times that we receive an impression like this, is that they go ahead and remove the partial from the tray and then pour that up. At that point, that impression is pointless, because the whole reason why we need this to be sent like this to the dental lab is for us to go ahead and pour it. And once that's poured with that partial in there and it is breaking out of this with the stone, we have more of an exact visual what the partial looks like in the patient's mouth, and it's a perfect guide to let us know how much more acrylic needs to be added. But if that partial is removed from there and that's poured up, there's absolutely no way that we can go ahead and guide ourselves with the impression that's used. So that is why it's very important that the 2 impressions in one are taken, and that is what we call a pickup impression with the partial in place along with the wash. So that right there is a long sentence title, but it should explain clearly what the procedure is. Now, I definitely wanted to share this video because I believe it's very important for you ladies to be informed as far as what a reline is, the procedures, and how long it could take, and what it could prevent. So there's many questions that are asked that I believe I've covered all. If you do feel that I'm missing something, please go ahead and make a comment, or if you are if you have more questions based on what I mentioned on here, make sure to comment on that as well. I am very excited to be sharing this information with you. I truly hope that all of this information is helpful. The very little or the much knowledge that I may have on this area, I will share it with you. Again, thank you so much for your time. You have a wonderful day at work. Thank you.